So now we're going to talk about alternatives to pharmacological agents to help in hemostasis. Specifically, we're going to talk about topical hemostatic agents, which are mostly used in the surgical fields. So there are many reasons why patients may not stop bleeding. Some acquired, some non-acquired bleeding disorders or coagulopathies, whether they be hemophilia or secondary to nutritional status, DIC, multi-system failure. And there are multiple medications that we now use, whether they are antiplatelet medications such as Plavix or factors inhibitors such as Eliquis, which are ubiquitous in our patients today. In addition to that, there are mechanical events, whether it be from cardiopulmonary bypass machinery or mechanical valves, etc., that can cause a coagulopathy. So, when we talk about bleeding, we have to realize that there are multiple different types of bleeding, and any type of bleeding can very well cause complications such as infection, transfusion-related reactions, occult bleeding, coagulopathy, etc. But like I said, it's very important to understand what type of bleeding, whether it be suture line bleeding or diffuse soft tissue bleeding, such as in a redo operation, bone bleeding from the sternum or from orthopedic procedures, areas or sites which are non-cauterizable because maybe they are in the neurological system or close to some very sensitive areas. Uh, Management of the coagulation of a patient, especially in cardiopulmonary bypass, when we anticoagulate a patient, is treated differently, as well as friable tissue, such as tissue which has just poor integrity and won't hold together. So all of these things need to um, take into account what you use for hemostasis. Now we have multiple types of abilities to achieve hemostasis, whether they be mechanical, whether such as just digital pressure, packing, sutures, clips, etc. Thermal, most commonly electrocautery, but also harmonic scalpel and argon beam coagulators, etc. Pharmacological agents, which we won't talk about, such as epinephrine or vasoconstrictors, antifibrinolytics, but what we will talk about are hemostatic sealants and adhesive agents, which are mainly used in talk about stopping bleeding. We have to understand what a clot is and how it forms and how it stays. The simplest way to look at it is in a primary and secondary hemostasis. So, what happens first when there's an injury to a vessel? There is instantaneous platelet activation with aggregation adhesion of platelets along with factor VIII and von Willebrand factor. Now, this forms a quick platelet plug, and the plug's job is to occlude the hole where a patient is bleeding from. But this plug is not stable. In order for maintenance of a clot, you need secondary hemostasis or the clotting cascade, specifically in using thrombin to form from fibrin to fibrinogen to form a fibrin clot. Fibrin stabilizes the primary platelet plug. Without the fibrin clot, the plug won't be stable and will fall apart. When we look at agents, there are two types mainly of hemostatic agents, that being passive and active. So a passive agent is simply a gelatin or collagen or cellulose type of agent which helps form the framework for the platelets to aggregate. In order to use a passive agent with success, a patient must have an intact coagulation system. The second type of agent is a active agent, and this is mostly thrombin, and these can be combined with a mechanical agent such as in FlowSeal or Surgiflow, and even be combined not only with thrombin but with fibrinogen as well. or what we call fibrinogen or blocks. As you go up this from passive to active with mechanical agents and sealants, these agents become more and more expensive, and they tend to be more and more successful in achieving hemostasis in various sites. In addition to that, there's fibrin sealant patches, which are the most expensive, but oftentimes can do an amazing job in stopping bleeding that you never would think would be able to stop with just sutures. I do want to mention surgical sealants. Sealants are not necessarily for hemostasis, but they're prevention of future hemostasis. Examples such as Co-Seal, Progel, Prevaleak, BioGlue. These are agents that we use to seal tissues so that increases in pressure or what have you, they won't fall apart. Nevertheless, they are on the shelves and really should not be used in an actively bleeding area. I just want to also quickly mention the VIBE scale, which is validated intraoperative bleeding scale, as a way to measure blood and to assess and help assess what type of agent you may need, in addition to the coagulation pathway being intact or not. This is the first surgeon-validated scale that delivers consistent and reliable assessment of intraoperative bleeding severity. Once again, the right agent in the right setting at the right time will give you hemostasis. Thank you very much.